Hello, everyone. Welcome back to Wednesday Echo. We're going to have the Pink Cloud Foundation doing a presentation on removing barriers and early recovery. And Kurt and I had previously met with Travis Winship from Pink Cloud, and he presented so many data points and things that I hadn't thought about before. So I think it'll be really interesting for our audience to hear more about what we can do to bridge the gaps. And then we have some great upcoming sessions. Kate LePage, you may recognize her name. She spoke on our Echo quite a few times, actually, and she's the regional navigator for Safe Harbor. And she brings up some excellent points on how to better recognize and treat folks dealing with sexual exploitation. And then, of course, we have Charlie coming up talking on hot topics in addiction medicine. So I'm sure that will be wonderful as well. And just remember, there are free CME offered with this session. Just make sure you fill out what Katie sends to get your CME. And we love to see everyone's faces, even if you are eating lunch. So turn your cameras on and interact as much as possible. And then just know that if you have any technical assistance needs, we are here to help. And Kurt always makes the joke that we can't help you navigate your personal life, but we're happy to help with any case needs, troubleshooting, program implementation, policy protocol, anything like that. And then Stratus Health is the home of the core website. Once again, if you need any assistance with policy or protocol, check this out before reinventing the wheel, because there's lots of excellent resources. All right. Travis, it looks like you made it on all right. Good to see you.
There we go. I got it.
Hey. Are you able to share your own slides?
Yep, I got them right here.
Perfect.
Get onto there real quick.
All right, well, we'll let you take it away from here.
Now it's for that awkward moment of like me trying to kill the dead time with trying to share my screen, so bear with me.
Where did you get your neon sign made above your head? That's so cool.
You know, I got it from a, man, I can't even remember the name of the site, but it was so cheap. It was like $100 for both of them. It was some crazy deal.
That's awesome.
All right, here. Sorry, I'm trying to get them both here on both screens.
So
of course,
good.
now I lost you. There we go. Share screen. It's funny. It's like I feel like I've been using Zoom ever since, right since the pandemic, and it's still nobody can ever seem to do it real smooth.
Well, and every now and again, there's the gremlins.
Yeah, I know, right? Let's see here. Share. Boom. Can we see that okay?
It looks like it's coming up. So you are going to want to switch to presenter mode. If you drop your cursor down to like the bottom right in the screen, you'll see it's like a little projector screen.
Yep. In PowerPoint, right? Yeah.
Yep.
There we go.
Yay, perfect. You're set to
good?
go. Yep.
Cool. All righty. Well, hi, everybody. I didn't even see who was all on, if I recognize anybody's names or not. If anybody has any questions, feel free to interrupt. Pretty informal. Also, want to make sure that I introduce myself at least, and I've watched some of the other Echo presentations, and I just wanted to make sure that I represented myself appropriately. I'm not a physician. I don't have a medical degree. A lot of this stuff is just, I wanted to present my experiences from a nonprofit perspective. As somebody who has been in recovery, somebody who has experienced kind of the growing pains of a nonprofit, and has kind of been on both sides of the services perspective of, man, why aren't there things available, or why aren't things done in a certain way? Why aren't things changing? Who's stepping up to the plate to kind of make things easier for our clients and our patients? And why haven't things been done until now? And why is it so slow? That's why I titled it, Is This Thing On? Because it just sometimes felt like either legislators aren't listening to us, our hospital systems, our treatment centers, sometimes our clients. So I wanted to kind of have a play on that as to how come I can't get this thing done by myself? And who do I need to engage? So if you have any questions, feel free to interrupt. I'm here to answer as best as I can. Some learning objectives we want to make sure we're able to be able to complete by the time we're done. And understanding the current drug overdose statistics. I don't know if anyone, I'm sure a lot of folks in here are pretty up to date on some of those numbers. I just saw the preliminary numbers for the end of the year. I know the last 2 months, I believe, aren't official. So I'll go over those for anyone who has not seen those. Identifying the barriers experienced by those seeking recovery. This is basically how Pink Cloud Foundation got started. So kind of, we'll go over kind of what was our inspiration. And I'll go over some of our programming as well to really help navigate that early recovery for your clients and patients as well. And then I'll briefly touch on the Governor's Advisory Council and some updates and our recommendations at the end of the year that we had for that council. And a little bit about me. I found the best AI airbrush photo I could of myself. So there's that one. But it was amazing. It's like, oh, my teeth are straight and they're all the same color. But again, so my name is Travis Winship. I'm the founder and executive director of Pink Cloud Foundation. I'm also an appointed member to the Minnesota Governor's Advisory Council for Opioid Substance Use and Addiction. Born and raised Minnesota boy. Been here my whole life. Like almost of a boomerang native, actually. Moved away. I lived in Las Vegas for about 4 or 5 years, in San Diego for about 1.5 years. I've been in medical sales for about 20 years, just over 20 years, all almost exclusively in women's health. Worked for a lot of big players like Johnson & Johnson, Medtronic, Thermo Fisher, Hologic, really focusing on women's health, genetic testing, also diagnostic equipment sales, all sorts of anything female body, genetics. Man, it feels like it's been a long time ago. I've lost my kind of my groove in talking about it even. But I actually left my career back in 2022 to do Pink Cloud full time. It's been interesting ride. I never would have pictured myself in this space, but and I also always joke that, you know, had I known how much work this was going to be, I never would have done it. But what I really actually attribute my recovery in my addiction to getting me to this place on a personal level, getting me to this personal space of, man, I kind of lost my kind of passion during for that medical sales, and I was good at it, but I just never really had a pull and something to really drive me every single day. And it took starting Pink Cloud Foundation for me to personally sit down and actually be motivated by kind of the mission and seeing our actions actually having a real impact on people. And I never really kind of knew that was something that I could do as a job. And so I credit my addiction to getting me to that place. I wish there would have been an easier way, but sometimes, you know, if higher power works in mysterious ways. But we started Pink Cloud Foundation back in 2019. I'll get into kind of more of our story here as we get flowing. A few more slides here, but I wanted to kind of give you kind of a little background about me. Any questions so far? Anybody have any questions on who I am? No. Just a couple of key folks on our team here. Christine Trammell is one of our board directors. She came on about 2 years ago, and she is the marketing director for the Minnesota Spay and Neuter Assistance Program. She's the one that's kind of leading up our pet program. She's had a long history of advocating for homeless and neglected companion animals. and folks in recovery as well. It's funny, my Connor Sloan, he's actually my roommate and one of my closest friends. Whenever I'm talking to folks in the recovery space and from a healthcare perspective, I always like to joke, somebody always seems to know Connor. He's definitely a definite force. Has a great story. He's a patient care coordinator in Revive Health down in Lakeville. But truly, he'll write a book someday, if not two. He's one of those guys, man. He has a story for everything. Nisha Plankers, she's a she's a director for sales management enterprise at Verizon. She's also kind of my fundraising and community outreach / treasurer. But that's kind of our main team. Here is, and some of this is repetitive, please jump in. But I wanted to go over this because I was actually looking over these statistics because I'm doing a presentation for another group this weekend. And the hall I'm presenting in is actually 1,165 people, or 1,128 people is what it is. And this is what was shocking to me is that the overdose deaths in Minnesota, these are preliminary numbers. You can see they're October, November, December. They haven't been confirmed yet. But this hall that we'll be in is just about the same exact number of how many overdoses have happened in Minnesota that have ended in death, which is, it's shocking. And it's one of the reasons what makes me really grateful to be part of the Governor's Advisory Council, is to be able to have a voice in how we can start to be part of that solution and have a voice at the table. Pink Cloud Foundation has about a little over 100 recovery home partners. I feel very strongly that housing is if not the component, but one of the main components to keeping somebody from overdosing, especially in those first few critical months post-treatment. So it's nice to have a voice at the table and to be able to talk about our experiences and be able to hopefully have some influence legislatively moving forward. But that's incredibly sad. Here are the January numbers as well. I wanted to make sure that we had those. These are, again, suspected, since it's a quick snapshot. And for those who aren't familiar with the site, there's a great dashboard on the Minnesota Department of Health website. It's right there at the bottom. But it's really, they do a really good job of keeping it up to date. Let's see here. Breaking this down, one of the things that I know we're focusing on from the council perspective is the opioid overdose deaths, but also the fact that it affects the American Indians 10 times as likely to die from an overdose than white Minnesotans, and Black Minnesotans as well are 3 times as likely to die. So our focus is definitely on those 2 populations as well. The last slide here, this next one is kind of the age breakdown. That's not too much of brand new news or anything, but just want to make sure that I had some context there for those total numbers as well. Here's a non-fatal. All right. All right. So has anybody, I guess, Aaron, maybe you can help me out here. Is there for the folks that are on the call, we have a kind of from a, I guess, specialty, I guess, what's the background of most folks on here?
So lots of providers, nurses, social workers from all areas, clinic, hospital, jail, And I think
Wow.
one
Okay.
of the reasons that I was so fascinated by this is being, from a hospital, clinic, and jail background, like I was so not aware that this even existed and why we needed it so badly.
Okay.
So that's why it's just awesome to hear about it.
Well, part of the reason why I ask is I just want to know, hey, who's heard about us? It's funny. It's funny. I always think that the people that do hear about us, I was like, wow, I can't believe we've had that much reach. And then there's oftentimes where I feel like we are making a lot of good headway and no one's heard of us. So I don't know if there's a chat or if a function like that, but feel free to throw it up in the chat if you are familiar with our organization. But how we uh, started was actually at a recovery meeting. We say that recovery begins with housing, and it came from hearing about this post-treatment barriers. And let me just skip ahead real quick here, just because one of these slides, I feel like it's just a little bit more fluid this way. Oops, it's not wanting to go here. Hold on. There we go. So we were founded in 2019. We actually were at a recovery meeting out in the suburbs. My home group took a meeting out to this treatment center once a week, and this was a Monday. And the one of their inpatient clients was at our meeting, and she stood up and was telling her story, and she was super excited because she had just celebrated 90 days clean that day. And this was a Monday. She was actually getting discharged on Friday. And typically when we hear those type of stories, people are so excited and they're kind of like, they're just super happy. And this poor girl was just distraught and fearful because she had gotten into a sober house. She had interviewed and had been accepted into the house upon her, what would it be this coming Friday? But there was a deposit required. And that kind of go back to my previous slide. There's a deposit that was required to move into the house. This is much like a security deposit or a damage deposit that normal people, the folks that will kind of experience that have to have a lease or something that protects the landlord. And it was interesting because I had never heard of sober deposits before moving in or before kind of this whole situation. And I had also had working with practitioners that other folks had also not heard of them either. And a sober deposit is just a security deposit. It is just like you would move into an apartment and pay that. It's an expectation you can't move in until it's paid. They just help protect the landlord. And it's a kind of a normal thing that's people that live in sober housing are used to paying or used to having to be required. But in her situation, as we're sitting in this meeting, listening to her talk, is that she didn't have a deposit to pay. She had no money. And going back and thinking about it, what people don't usually show up to the treatment doors with cash. They don't have a bunch of extra money in the bank. They kind of show up when they're on their last leg, or they're not showing up in the best of conditions. So to expect somebody to go to treatment, graduate, and then have a $300 extra deposit laying around to move into a sober house, it didn't seem realistic to me. And that's what we were hearing from this gal that was presenting. And so my heart broke for her. And because last week, somebody celebrating treatment for the first time ever in their life, or celebrating that being sober for that long. This week should be about planning that next kind of step, and really excited time for them to try and finally be able to do the things that they had always thought they might not have ever be able to do because of their addiction. And unfortunately, this was happening to this girl, is that she got into a sober house. She wants to take that next step, but she can't. And so my brain, of course, starts spinning around. And how does this look like from a business perspective? Is kind of the way that I took it. Because to me, it just doesn't make sense for somebody to have to go through all that from a business perspective, from a moral perspective, and then from the client's perspective, it just seems like torture. Because this is kind of how the typical scenario broke down. The client enters into inpatient treatment for 30, 60, 90 days. The client graduates and is discharged from treatment. The client will then return to the previous unsupportive living situation. If they don't have that deposit, they're going to go right back to where they were. And we know from the data that there's a massive increase rate of relapse and overdose and death. In fact, at least for those that are leaving a controlled environment like incarceration or treatment, there's an increased risk of overdose death of like 12 times more likely in those first, I want to say it's first month or so, which is, so this obviously this time post-treatment, as soon as they graduate, those first few weeks are such a critical and delicate time. And you're telling me based on this current model that we have, that we're going to put all that time and effort and money into getting that person well and treating that person for what? To put them right back in the same position that we got them from. It just, to me, doesn't make sense. And we know historically that 1 out of 10 people with a substance use disorder problem, only 1 out of 10 will actually make it back to those treatment doors. So we're going to go through all that problem or all those steps and expense and if that person lives, if that person actually does live, doesn't have an accidental overdose, and they make it back to treatment, we're that lucky to have all that happen, and they make it back, what are we going to do? We're going to do it all over again. And it just didn't make sense that how this one little barrier could really keep the cycle going or keep the person kind of in this loop of not getting the care that they need in order to be able to take that next step. So my friend and I, we actually on the drive home from that meeting, called that sober house and paid her deposit anonymously just to give her that week back. And so because she deserved it, she had worked that hard, she deserves to be able to have a peace of mind. And then we got to looking like, well, what resources are available? What things, surely we're not the only ones that are experiencing this problem or are seeing this problem. Maybe it's just maybe resources are available and folks just don't know about it. Maybe it's just a communication issue. Coming to find out, so we did some research and we really found that there's a massive need out there. There's organizations that have paid deposits before for folks, but no one who's really focused on it. And so my commitment with my friend, and he actually had to step out of the business for about 9 months into it for his own personal reasons. But I knew that if I wanted to do this is something that it had to be legit. It couldn't be a flash in the pan organization that just wants to do a GoFundMe. I really wanted to find a long-term solution. I don't know yet if I found that. I mean, we've been around for 5 years, but there's still so much work to do. But if we could just, for those few people, or as many as we could, find a solution to give them that peace of mind so they knew that when they left treatment, they have a place to go to continue that next step. I almost feel like it's been kind of my personal, I don't know, paying the world back for all the stuff that I did in my active use. I guess my emotional debt, we'll call it. But I started coming up with this, just hearing all this feedback about recovery doesn't start until we have housing secured, and it just has rang true the more and more we hear about it. So this is what we're doing to try to break this cycle. I made this, I like this graphic I'm really proud of because it's me just killing time on other conference calls. But that always makes me laugh because the stuff I come up with in my head, it just makes sense in here. But so our recovery housing program is obviously our first program that we started with. Our day is actually really interesting that we're having a call today because it's almost 5 years to the day that Pink Cloud mailed out our very first security deposits for or sober deposits for our first 9 clients. And yeah, it was, I think, what is it? I want to say it was the 29th, 28th or 29th, something like that. But 5 years later, we've have over 100 recovery home partners that we work with, and we've actually placed over 700 folks into a recovery home through helping them pay their deposits, which is great. It makes me, I'm proud of it. We've done a lot of work, but I always, whenever I tell people kind of our progress and the numbers that we've kind of have so far, I make sure that they know kind of like the good, the bad, and the ugly, and that this resource gap still definitely exists. Pink Cloud Foundation has received over 3,200 applications for housing assistance from the recovery community, which means that we're about 23% of the applications that we get are the folks that we can help, which is super frustrating. It kind of goes back to why hasn't this been addressed yet in a bigger way? And I always like to make sure I remind people that these aren't individuals that are, this is not day one for them. These are folks that have already taken that first step in their recovery by completing treatment, and they have a desire to keep going. It's just shocking to me that we don't have a better way of doing things. And so we continue to work with our recovery home partners. We are working with them on partial payments, letting folks move in. COVID was a big kind of kick in the pants for a lot of folks because there's a lot of unethical things that were happening during COVID and people getting kicked out during the pandemic and putting in a really vulnerable position. So there's been a lot of conversations and a lot of reworking their deposit programs. A lot of folks will have just a move-in fee as opposed to a deposit. It'd be a lot cheaper. Just looking at different options and being more creative and allowing them to have people move in without such a large upfront payment. But still, sometimes even if it's just $100, folks don't have it. So trying to come up with other solutions for that. But so we've again placed about 700 people. And this first programs I wanted to talk about today are going to be on the post-treatment side of things. I'll get into pre-treatment after this next program. But here is another national statistic as to why that delicate time right after treatment. It's so important to make sure we have housing secured. So obviously folks with substance use issues relapse multiple times in the first 90 days. The big one here, less than 20% of those in an outpatient program maintain complete sobriety for an entire year. I put this one up here, and I would kind of, the reason why I wanted to have it up there is because we were able to survey the folks that that have actually had services through Pink Cloud and housing. This was done about 1.5 years ago, I think. Granted, this is just a survey, not a study, but I circled on that previous page 20%, because these are the type of numbers that we're used to, the relapse rates and folks that maintain sobriety for 1 year or 90 days. They're kind of in folks that works in this industry like y'all is. It's hard. It's hard to work hard. This hard with so many people, and to see kind of the relapse rate be so high. These are folks that we surveyed. We received 178 responses. And some of these answers are just really heartbreaking. But one thing that gave us hope and what told me that we were on the right path was how many folks were able to stay sober for longer because they had housing secured. But the question that we asked them was, from the day you received assistance from Pink Cloud Foundation for your recovery housing, how much longer did you remain sober or clean? So this is basically from day 91 on, or the day you moved in. So whenever you left the treatment center and you started your first kind of day out in the real world, we'll call it, how much longer did you remain clean? And again, this is a survey, it's not an official study or anything. This is just our numbers and self-reporting as well. So 61% of respondents were sober for at least 1 year or more, which is, that's why I had that 20% number circled on that previous slide, is because that was a number that we weren't expecting, which is exciting to hear. And of those 61%, so it was 100 and I believe it was 109 folks, of those, more than half were still sober at the time of the survey and were sober for at least a year, which is incredible. So to take that number from 20% to 61%, or even as half of those, so that's just it just spoke to me that housing is the critical component. It's a hierarchy of needs. It's once we have that, we know that our clients and our patients stand a little bit more of a chance. So it's important to have that secured before leaving those treatment doors. And part of that is not just having the housing secured, but having the deposit secured. Some other questions that we asked them as well is, what, in your opinion, what is a very likely event that could have happened that you could see really being something real that could have happened to you in your life had we not had been able to help you with recovery housing? And some of them, 72% said my sobriety would have been at risk. I think it's the obvious one. I would have returned to an unsupportive living situation. That was just like the gal who spoke at that recovery meeting. 44% said I had to live in a shelter. That's going straight to treatment doors to being homeless. I had to live with people who are actively using, 56%. 68% I would have been homeless right out of the gates, which that's where we're trying to prevent. I would have been actively using drugs or alcohol within the first week. That was 33%. This next slide is the one that kills me every time. I don't get it, how we can put all this effort and investment into somebody and they leave treatment and they feel like they could have died, all because of housing. That is the one that really makes me kind of stop and think, and think that there's got to be a way we can do this differently, and not put so many people at risk. How important was sober living in your overall recovery? Almost 90% say it's extremely important. Obviously, you have your community and being around like-minded people. Without housing assistance, how likely would you have used drugs and alcohol or relapse sooner? Again, very typical. And then how much of an impact did we have on your recovery? Pretty obvious. So that's what our housing component. Our programs have all started because of listening to folks in the field, listening to folks like you, folks that are really experiencing troubles with receiving services, frustrated with the system, and just basically telling us what they need. Here we have kind of getting to learn the community and through our housing partners and folks that are just going through the recovery process, is that we found that, okay, if somebody got into a sober house or recovery home, and the recovery home doesn't even provide bed sheets for the bed, basic necessities that really can be very expensive. I mean, we all know to buy bed sheets and a pillow and all these, even a bath towel, these are very expensive items, especially when you have no money. we have these priced at about $150 is what it would cost to somebody to buy these. And just basic items just aren't provided to these folks when they leave treatment. So we call them our jumpstart kits. It has just your basic necessity items in that travel kit you'll see there on top left. We provide them with a bath towel. We provide them with shower loofahs that comes with all in a drawstring bag, as well as the full sheet set, the pillow, laundry detergent, just those basic items that could really, really be helpful for somebody who's just leaving treatment, just trying to kind of get their footing and just kind of starting all over again. What I like about comparing this with the housing component is that these are things that allow that person to get started and to start looking for work and to not have to worry about these little things, these little barriers when they should be focusing on their recovery or finding a job. It just frees up so much more headspace to not have to basically have that peace of mind again. Again, it's not much. I mean, these are just little minor things, but they can really be big things that can really pull somebody off track. So that's other program that just came from working with folks in the field. So those are the housing and the bags, those jumpstart kits were kind of the post-treatment. Well, as we started doing more outreach in the community and talking with folks, a lot of case managers, and kind of hearing kind of one-off stories, what we kept hearing was that there are oftentimes where we are interacting with the client and this patient or this client wants to go to treatment, which when that opportunity presents itself, we have to grab it and get them into treatment, because sometimes it's fleeting. We don't have those opportunities very often where somebody wants to go. But there's always a but. But my client wants to go to treatment, but they have a pet. Or my client wants to go to treatment, but they have personal belongings that can't be left where they currently are residing. So they're afraid to leave. They don't want to leave their pet behind. They don't want to leave their belongings behind, but they have to, or they're just not going to go. And historically, there have been no solutions for these clients. So we started a program called Pink Cloud Pets. This is by far become our most popular, and then kind of the one that gets people are most excited. It's actually kind of our most simplest one from an administrative perspective. But it was so novel that we've received a lot of attention for it. This Pink Cloud Pets program aims to connect pet owners seeking recovery from substance use disorder with safe and loving animal fosters, volunteers, and caretakers across our community. And from the folks that we've talked to, many will admit that they've avoided treatment, delayed treatment, or even left treatment early just to care for their pet. Our little slogan for this one is reuniting healthy pets and owners in recovery. A lot of wonderful stories that come out of that program, as you might expect. We actually just a couple months ago have a new partner with the Animal Humane Society. They heard about our program, and they have offered food supplies, basic vet care, vaccinations, spay and neutering services, labs, medications, which is great. We obviously why we wanted to partner with them is from a foster perspective, is that we have way more applications than we do fosters. So if anybody out there would like to foster, would know folks that would like to foster, please reach out to us on our website. But all we really are is just a provider of a list. We will provide this list to folks who apply online, and we kind of let the folks, the volunteer and the client, work out between themselves on how kind of an arrangement they want to have. But we just wanted to be able to provide an opportunity for folks that are willing to help with folks who need the help, and kind of just connect them is what we do. The next one is, man, I have a client who wants to go to treatment, but they can't because they have things that they need to be, whether they're personal, sentimental value or actual real value. They can't leave them where they are because they'll get damaged or stolen or ruined, which If you're homeless, of course you can't leave things where you are because you're always having to bring them with you. But you can't bring those things into treatment. So we started a Pink Cloud Prets program. We actually really neat. Just had somebody, one of our donors just paid for our storage unit for the next 14 months, which is fantastic. Always looking for other larger and bigger units, but we have a big, I think it's a 20 by 30 foot storage facility, our storage unit in a facility over in St. Paul. It's just a nice place, again, to give that folks that peace of mind that, gosh, I at least have my stuff. I don't have to worry about it. It's safe, it's secure. I can focus on my recovery while I'm receiving the care that I need. So that's our other program we have available as well. This one's very simple and straightforward. They fill out an application and we verify through the case manager about the kind of their need. We do an intake and inventory of their belongings. They sign over. This is kind of the stickier part because especially you have clients who might not trust folks in the system or folks working in the field that we do, but they do have to sign over temporary ownership of their belongings to us. Just the way the rules are with the storage facilities, because we can't have multiple folks having access to it. It's just a temporary thing while they're in treatment. We do a full inventory, and the client attends treatment and completes it, or whenever they get out of their program, we do a final inventory and we release their belongings to them. And it's relatively straightforward, but we do like to make sure that everybody knows up front that the ownership is a temporary ownership agreement. That is something that is required by the storage facility. But still, again, it's an option for them to be able to have that peace of mind. There's some awards that we've been able to been very graciously presented with just recently. The big one was from the Minnesota Department of Human Services. We were nominated and received actually the Commissioner's Circle of Excellence Award. That one was really great. It was that one. I'm really proud of that one because that one was just word of mouth. But to me, all of these, what doesn't matter the awards, I'm not in it for the awards, but it just screams that we're doing the right thing, or we're hitting while the iron's hot. Whatever analogy you use, something needs to be done, and there's still more work to do. Our PET program actually received an Anthem Award this last 2023, so last year, for program innovation. The PETS program is actually the first program in the state, and actually the second technically in the country that focuses on recovery in pets. There's a one-man operation out of Dallas who actually we consulted when we were starting this program. But I have a feeling we see a lot of these be popping up all across the country. And it's actually the part of the program that I actually see having the most potential as being a separate thing, a separate entity. And one thing that I'm focusing on for the next 5 years or so is getting our own building and facility, because just of the feedback and the need within the community, it has sustainability there. There's just such a massive need for it. Let's see here. I mentioned at the very beginning, I'm part of the Governor's Advisory Council on Opioids, Substance Use and Addiction. Folks who might not know about it, it was signed into law during the 2022 legislative session. There's 18 of us on that council. We meet every other month, and we this is kind of just the kind of our basics of our what we do. We're there to advise, identify, examine, and provide. And what we're basically doing is the funds that are receiving from the pharmaceutical awards that were against the pharmaceutical companies for the opioid epidemic, is finding smarter ways to spend that money. And there's no better way than actually talking to folks who work in it every single day, folks that have lived experience, and just really being smart about it and where can we affect the most change. And our recommendations have been obviously to focus on the American Indian population and also justice involved folks. referenced earlier the increase of the chance of somebody overdose and having an overdose with death is drastically increased for folks that have been in a controlled environment for a certain amount of time, and their tolerance has gone down quite a bit. And these are the folks that we see dying most often because they're either discharged from their incarceration facility and they aren't given the medications or have the options to be using those medications for opioid use disorder in jail, that aren't given Narcan when they're leaving. They just don't have those items, and so that's why we see this massive increase in overdose death among these populations. It's sad, so we're wanting to focus on those and making sure people have these options while they're in jail as well. Again, it's important. I don't think I have my other one on here, but so one of the things that we were focusing on as well is the American Indian population and having programs and the resources available to them as well. Little summary slide. I have this in a PDF and as well as kind of handouts for folks that I give at events and festivals and things like that. Just kind of nice one big summary. And here's my shameless plug. That's kind of what we do. Any questions at all? I haven't seen. I haven't even looked at the chat.
Yeah, there's quite a few that popped up in the chat.
Sorry.
Great talk. And like I said, my mind was just kind of blown by all the unique services that you all offer, like the pet services and storage. It was super cool.
I like to remind folks that these are just suggestions that came from the voices of our community, like folks like y'all. Is that I wish I was that smart. I have a joke of like, hey, I'm just kind of learning as I go with all of this stuff. I was in medical sales for a long time. I can kind of talk my way through things, but we're always looking for board members or folks that would like to pitch in and help out, or maybe might have a better way of doing things. I'm all open. I'm not married to any one idea forever. But if you have an idea, if you think you could help, and you want to pitch in and join us, we would love to have other folks join us.
All right. Some of the questions in the chat were, what does recovery housing supply look like in Duluth? And do you have to be an MN resident to qualify for the program?
Nope. We don't have to be a Minnesota resident. We're not. Our funds aren't tied to any specific government program right now. So as long as the recovery house is in Minnesota, there are some in Duluth. Duluth, man, they need more housing. We don't have any restrictions on who we help. But when we first started with paying deposits, we didn't want to be in the business of verifying what's a sober house and what isn't. So we kind of took our direction from the Minnesota Association of Sober Homes, often called MASH, because they have their own certification and kind of self-regulating system that they use. We knew that everyone there was a legit sober house, and I don't know, they've gone through the extra steps to be part of this group that kind of they also have their own certification, which just gave us more peace of mind that we're actually giving money to folks that are providing a space for people to find recovery. We have, not that we've gone away from it, but through creating relationships and over the last 5 years, we've gotten to know folks and we can trust them. So they no longer have to be associated with MASH, as long as we have some type of working relationship. But obviously you have to be licensed with the state. But Duluth is a place that definitely needs more housing. But there aren't houses that we say no to. As long as you're registered with the state, we will be happy to help out. To add, if you are a sober or recovery home owner, They can just go to our website, and on the application page, it says add my sober home, and they'll fill out a quick form to get you on our list. But we'd love to have all of them. So.
Awesome. What other questions are there?
I have a question about the pet program.
Mm-hmm.
I know that you said that you're a connector, but can you give me an estimate about how long it typically takes? I've been aware of the program for a while, and I think most of my information comes from when it started, when people were like, oh, it just takes forever. It doesn't. I work in a hospital where we've got people on short timelines.
Yeah. So we do have, again, okay, so let me answer two ways. One is when somebody presses send on their application, what they should get is an email with a link. I can't remember, I have to go back and double check, but I believe when we submit the application, actually the link should pop up right away to a private web page that will take you directly to a downloadable link. I'm pretty sure it's actually just emailed. So it's oftentimes we hear that those will sometimes get pushed to spam, but so it's from a timing perspective, that from our end should be pretty quick. Since we are the kind of connector, I'll give you another kind of a two-part answer. So we work with all volunteers, and we have such a short supply. We ask that folks reach out to the volunteer from the list that they receive via email through that link, and to inquire about availability. If you don't hear from anybody, it typically means that they're busy or they don't have availability. And that frustration of we're in a time crunch here, we need to, we really need to get this animal placed, which is part of the reason why we brought on the Animal Humane Society. And we're actually looking at partnering with another treatment center as well. I can't really say which one yet, but we're trying to broaden our access to foster families, so we can have more availability. Because when I mentioned that I see Pink Cloud Pets for next kind of my 5-year plan is really having that be a program that it's its own thing, because the need is so massive. And I mean, it's part of the reason why I quit my job full time. I do this full time, is just it just needs to have somebody at the wheel every day. And the need is just so huge, and there's an opportunity there from a business perspective to really make this thing a thing, like a big staple in our community, and from a recovery resource. So I apologize if you have experienced some kind of slowness in getting folks fosters, but we're working on it, I promise.
No, that was just old information. What's happened now is I've got somebody who's on a commitment, who's going to be placed, but not right away. And it's just going to be tricky because they're going to want to handle the contact and everything themselves, and they've got a kind of limited time in which to do that. Not only time before they enter the facility, but time available to them for technology right now. But I'll just print out everything on the website, including the form that you fill out, and give it all to them, and just hope for the best. And
then my phone number here, if you want to give me a call or shoot me an email, just so we can maybe, if I hear it from another foster that their availability is opened up, or if I can do anything, I think we could connect one-on-one as well.
That would be great. I would appreciate that very much.
All right. Jennifer says, thank you for the amazing work you are doing. Basic needs are not so basic for people who don't have them. Totally agree. Yep. Anyone else have questions for Travis? All right. Well, we would love to have you back at some point in time as your program grows and evolves and you offer more services than you already are. It's just super cool. So
Yeah,
thanks
thank you
for
so
popping
much.
on.
Yeah, not a problem. Again, if anybody's interested in voicing an opinion or have a better way of doing things, or interested in becoming joining our board, would love to have. I like to surround myself with people that are smarter than me, so which isn't hard to do. But please, we're open to feedback and would love to have you. So thanks again, everybody. I really appreciate it. And Aaron, you gave been great. Thank you so much.
Have a good one, everybody.
Bye now.